welcome back, dear viewers, and more details about the activities of the second edition of the International Conference on Population, Health and Human Development, PHDC, that is held under the patronage of President Abdel Fattah al-Sisi, and it is during the period from the 21st to the 25th of October under the theme Human Development for a Sustainable Future. And I'm really delighted to know more details about it with Dr. Nadia Zakhary, former Minister of Scientific Research. Good morning, Dr. Nadia.
Good morning, dear.
Good morning. How do you see the conference as a dynamic platform that enhances the implementation of the goals of the Presidential Initiative for Human Development, Bidaya?
Of course, it's a very important launched initiative. And as you can see, this is the second edition of the conference, and this means that the conference was successful last year. But this year it has another impact or another field to study, which is the development of the people, as you said, as the initiative of Bidaya. So it discussed problems of health, of population, and of human development. And of course, the first thing that people need is their health. So discussing what we can do in the health to develop the people, it is very important. And many topics were discussed, not only by Egyptians, but there were other countries like Iraq, like Palestine, like Iraq, African countries, and so on.
Well, of course, when we talk about this conference, we know that we have many challenges that we are facing. And definitely, as we can see now, Egypt is moving on the track of Egypt's vision of the Sustainability 2030. So let's discuss more about the challenges we are facing in this respect. And of course, we're approaching to, we achieved a lot, actually, we can say, from this vision we are adopting.
Let me say that the first and the most important challenge is how to have our own medication. There is a problem that many of the medications we export from outside, and this needs a large budget with dollars. So doing our own medication is very important, and it was discussed in a certain session. They discussed the clinical trials to be done to have our own medication, because we have many scientific research which indicates that many compounds can be used as medications for serious diseases like cancer, like diabetes, like blood pressure, and so on. But we don't continue the researches on the clinical trials so as to have the FDA approval, and we can manufacture our own medication. So a session was devoted to this topic specially. Other sessions were devoted to the development of people, like you said, like the empowerment of women in the field of scientific research and technology, and in other fields. There was a sort of, not a museum, a sort of exhibition for some medication, some medical tools, some things done by the Egyptian National Council for Women. These were the most important topics, and of course there were topics that sessions that were discussing the disease of cancer, its incidence, the medication required for the cancer, the problem of the different investigations, and how can we use the important investigation, not using every investigation that can be done, because this goes with the economy. Because if a doctor will say, do this, that, this, and that, without taking care of the economy, this will be a problem, and this was also discussed. These were the most important topics, and in other diseases as well, not only cancer, but being in the National Cancer Institute, that was my main interest.
Yes, Dr. Nadia, you mentioned a very important point, which is women. And my question is, what are the necessary measures assessed by the conference to enhance women's health and also economically empower them and boost the role of health sector workers?
Of course, you know, the 100 million Saha, it was devoted first for the women, for the breast cancer and the health of the women, and then it was for the children, for the dwarfism, for the blood pressure, the diabetes, and so on. But at the start, it was devoted for the women especially. Another case was, as I told you, the empowerment of women. How can we empower scientists and technologists to be a leader in her place? And this was achieved by some initiatives by Cairo University, by the National Council Institute, the National Council for Women, and first of all the initiative of the President, the PLP, which is the Presidential Leadership Program, and we discussed that yesterday, how it achieved empowerment for women. As we see, about 18 deans were appointed last year at this year at Ain Shams University. And the problem of scientific researchers was that women don't reach leadership positions.
Well, President Abdel Fattah al-Sisi, since the first minute, has always been keen and taking care of the Egyptian citizen and providing as much as the Egyptian leadership can better environment. So, of course, you mentioned from the very beginning the health state, and of course this is very, very important, and as we have seen, we have the Egyptian leadership adopting many initiatives in this respect. How far did this help? We have really taken many of these initiatives taking place all around the country.
It helped a lot for the youth and the women to reach leadership and decision-making positions. This was not before. And I don't mean that we have to put a youth or a lady in a leadership position because she is a lady or he is a youth. They must be empowered and they must be well qualified. So being well qualified needs certain training courses, certain programs, and as you said, President al-Sisi has launched many initiatives to empower youth and women to take a leadership position, and this happened this year, as you can see. Also, the Sustainable Development Goal 2030 discussed 4 pillars to empower women in the field of economy, social leadership, and other fields.
Yes, Dr. Nadia, and you mentioned earlier about the technology and also about the medical research and the investment also in the research in general. So I would like to ask you, in this conference, how was these issues tackled? How did you tackle issues like more investments in the research in medical research and research in general, and also the resolution of some health problems like the long waiting lists, for example, that we're facing in Egypt?
Let me say that all the researchers that were discussed are researchers, applied researchers. We are not only saying something that we don't do or we are not aiming to achieve. As I told you, we are aiming to achieve how to develop our medication and our drugs to lessen the export from outside. Also, the new techniques to use. The waiting list is really a problem in some places, but it's not a problem in others, and it is not like before.
Sure.
The waiting list has been diminished a lot. But there is a problem because some places people like to go and they have confidence in it, and when you tell them you have other institutes and other hospitals, they say no, we want to come to the national, for example, to the National Cancer Institute because we have faith and confidence in it. And this is a burden. However, the National Cancer Institute now, we can say that the waiting list, maybe there is no waiting list. We are about to have 0 waiting list.
Well,
but there are some problems, but we cannot solve it. Like sometimes there is what I want to say. The drug is not present, the injection, the material used, so we have to wait till we get it. So this is out of the hands of any hospital. When you don't find, for example, the material which you have to make an MRI with it, you have to wait. Waiting few days. It's not waiting for months or something like that.
Sure.
Talking at the same point, actually, we started to see also this real awareness in this respect and involving youth in this. And this is of great importance because definitely whenever we're talking about researchers, we need fresh blood. We need the people who are thinking out of the box because to confront all these challenges we are facing, we need new ideas. And we can see now this, the youth taking an important place, positions in this respect. Tell us more about it. Can we elaborate how important it is and how important it is to work on this awareness, not only about youth, but starting with the children as well, to be capable so when they grow up, they can add and give more in this respect?
Yes, it's very important to let everybody think in an innovative way, not in a way that I repeat what has been done. I have to think out of the box. I have to find the problem. What is the problem I want to search at? And then I search, not searching and then I see is this important for research or not. I have to go down to the place where it needs my research and know the problem and think how can I solve this problem. Regarding the children, I'm so happy that the schools now are giving projects for the children to search in the computers to give a solution for a certain problem, whatever this problem is, scientific or social or whatever, or search in a touristic place, something like that. So this will make a sort of innovation for the children, and when they grow up, they will like searching, they will like innovation, they will like thinking out of the box and not repeating everything they learn and put it in the exam and finish.
Yes, Dr. Nadia, and I would really love to stay more with you on the phone, but as a last question to you, what messages is this conference is holding to the whole world?
The message is that the world is a very small, like we say, very small village. So we have to take from others and give others. We have to share our experience, because experience is the most important thing to upgrade ourselves, to know our problems, to know the problems of others, and if we can help them, we can help them. If we can transfer the technology, we can transfer the technology. So international conferences is very important to know all over the world what is going on.
Right, Dr. Nadia Zakhary, former Minister of Scientific Research, thank you very much for joining us. And moving on to a quick break, then we'll be back.